Glenn Harper. I am a neurosurgeon, and I moved over to advanced pain care about 4 years ago and specialize in the neurosurgical aspect of pain for our patients that come to our pain center. The things that inspired me to pursue a career in neurosurgery really started when I was very young. I knew I wanted to be a physician. I actually knew I wanted to be a surgeon. And over the years, kind of deciding what kind of surgery was important for me. And so during college, studied psychology and really learned about the biology, the neurobiology behind it. And that sort of started this journey. And then eventually in medical school, really liked the techniques, liked to see the things that patients presented with. And so those are the things that really set off my career in neurosurgery. I think one of the most important qualities for a neurosurgeon is compassion and empathy. I really believe that it's such a difficult field with so many patients that are really going through the hardest times of their lives. That to be able to be a good neurosurgeon, you have to have some empathy and understand where they are. The more you can understand where that patient is, the better you can understand how to apply the tools that we have to really help that patient. My approach to patient care in general is an approach that I call the minimum necessary, which is to do the least amount to get the greatest benefit for the patient. But of course, to be able to do that, to talk about minimum necessary, I have to understand necessary for what. And so one of the big things that I want to do first off in any of my patient interactions is really communicate with them, understand what their needs are, what their desires are, the things that sometimes seem obvious to me or not at all what the patient is looking for. So the first thing is open lines of communication and making sure that we have the same goals, and so that I can help that patient meet those goals. The aspect that I find most rewarding of neurosurgery is great patient outcomes. That's what it comes down to. And that's going to be true probably of any specialty, but really that's why we're here, is to see patients get better and do well. And so at one point in my career, I really enjoyed certain techniques or certain procedures more than others. And eventually it got to be that whatever was the right procedure for that patient that would give them a good outcome was my favorite procedure. Outside of surgery, some of my other interests, one of my biggest ones is just spending time with my family. I have two new grandsons, twin boys that are 9 months old. And so when I leave work, I go home and hold the baby, which is one of my favorite things to do. I also recently have taken up baking and am on a quest for the perfect loaf of sourdough. And so definitely making strides with that and enjoying learning to do that.